Blood is a complex biological fluid. A great deal of work has been done to understand the multiple biochemical and biomechanical changes that take place once it is removed from its host and stored. However, the possible clinical implications of transfusing this stored biological product are only beginning to be better understood. Dr. Andreas Meyer-Hellmann and colleagues from the Helios Clinic Erfurt, Germany, used a cytoscan to film the sublingual microcirculation pre- and post-transfusion in a patient with severe gastrointestinal bleeding. The patient's hemoglobin fell to 2.8 grams per deciliter. This video shows the microcirculation after initial resuscitation with an acellular volume expander. What red blood cells are left are circulating through all the multi-cell and single-cell capillaries. The next video shows the same microcirculation after the transfusion of 3 units of stored allogeneic red blood cells. Clearly, here there is reduced flow. Single-cell capillaries are swollen. There is uneven distribution of the red cells, blockage and sludging, and many areas where there are no red blood cells in contact with the tissues. This work starts to provide insights into the possible mechanisms underlying the limited evidence for transfusion efficacy.
As clinicians, we have learned 3 key lessons. First, even the most profound anemia can be sustainably and quickly corrected without utilizing allogeneic blood products. Second, perioperative blood loss, even in complex procedures, can be significantly reduced. And third, post-operative treatment of asymptomatic anemia should be applied universally to sufficiently restore the patient's endogenous red cell volume.
It really is a sobering thought when one considers that allogeneic blood transfusion has the potential for a wider range of adverse clinical outcomes than probably any other medical intervention.
After considering all available evidence on transfusion and outcome, we are left with the conclusion that transfusion is a major multiplier of morbidity and mortality. Maintaining the status quo, as we see in transfusion practice today, would just not be accepted or tolerated in any other field of medicine in the context of current safety and quality standards.